Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hey, everybody. This is Dr. Mark Sims here. I'm the host of the Listen Up podcast, where I feature top leaders in healthcare. This episode is brought to you by Arizona Hearing Center. I help patients to effectively treat their hearing loss so they can connect better with their family and friends and remain independent. The reason I'm so passionate about helping patients with hearing loss is because I lost my brother Robbie twice. First from his hearing loss from radiation to his brain tumor, and again when he passed away. I only care for ears. I'm the ear of ENT. I've performed over 10,000 ear surgeries over the past 20 years. I'm the founder of the Arizona Hearing Center. I'm the author of a new book, Listen Up. Go to listenuphearing.com. And if you want to learn more about me, go to azhear.com. Contact us with any questions or comments. Today, I'm really excited. I have Dr. Devin Cunning here. He has practiced in Lake Havasu City since 1999. He's attended the University of California, Santa Barbara, and graduated magna cum laude in biology. After receiving his Doctor of Medicine degree from the Medical College of Wisconsin, he served on board the aircraft carrier USS Kitty Hawk as the general medical officer for 2 years and traveled all over the Pacific. He completed his Otolaryngology residency at the University of Pennsylvania. Him and I first met in an ear surgery course in Los Angeles while we were both residents. He's got amazing credentials. He's dual board certified in otolaryngology, head and neck surgery, and sleep medicine. He's a fellow in allergy after completing advanced training through the American Academy of Allergic Allergy. He's a fellow of the American College of Surgeons. He's a member of the American Academy of Sleep Medicine, Association of American Physicians and Surgeons, and the ENT Academy. He served as the Chief of Surgery and Joint Venture Board member at the Havasu Regional Medical Center and Chief of Staff at the Havasu Surgery Center. He's married and has 4 wonderful children. I'm sure he's an awesome dad. He's doing great, and I'm really excited to have him here. Devin, welcome.
Mark, thank you so much for having me. This is truly my pleasure. Pleasure to see you.
Oh, yeah, thanks so much. I appreciate you giving the time. This is great. Hey, one of the things I love to find out about patients is what was your medical journey? Like, how did you go from, being Devin Cunning to Devin Cunning who wants to aspire to be a doctor and then an ENT?
Yeah. Well, great question, Mark. I've always been, like probably a lot of us, interested in biology. And as a child, I was very active with animals. I was kind of thought my journey was toward veterinary medicine, honestly, in the beginning. Loved herpetology, snakes and reptiles and crawly things, and ended up going to UC Santa Barbara, a great biology university, and kind of thought about my options, and came to the conclusion that human medicine was going to give me a little more interaction maybe than veterinary medicine. So
you can come to our house and do snake rescue. A couple of snakes we've had at our house. There's actually these people who come and take the snakes away.
I would love to do that. I love the creepy crawly things.
Well, it's kind of funny. So the last one we had was like he was like a 14-year-old boy that his mom drove there, and he had just a picker-upper and like one of those grabbers and a pillowcase. And I said, "Why are you into this?" He just looked at me and goes, "I just love snakes." So there are people who love it. So
yeah, I'm one of them. I've fortunately or unfortunately been bitten by a number of snakes when I was learning, but I had those little field guide books, so I made sure I wasn't bitten by anything that was going to hurt me.
Sorry to interrupt. So you're
well, not all. So
on people medicine rather than animal
people medicine, and then when I went to UC Santa Barbara, it really became clear that was my destiny was going to be adult medicine. I originally thought about pediatrics, which kind of goes along with veterinary medicine because they can't answer too many questions.
Right.
But then as I was going through medical school, it was a personal experience. My stepfather, who has since passed away, had melanoma, and he had it in his lip, and he had an Estlander flap, which for those who don't know is a large cut out of the lip with part of the face moved around to reconstruct the lower lip, and a neck dissection to peel out lymph nodes. And although the surgery went well and he survived for a few years after that, he succumbed to metastases. And it really got my interest in head and neck surgery and otolaryngology.
Yeah. And, so that kind of sealed the deal, right?
Yeah, absolutely.
Okay. And so, I know you practice it for quite some time. Like, tell me, what's your favorite part of the day, or what is it that, keeps you going every day?
Well, it really, that I can tell you, it's not the computers. It's not clicking buttons. It's not talking to insurance companies. It really is. It does come down to the patients. And I have this little saying that I say all the time to patients. I say, I'm going to pull back the curtain for you. What do we really care about as doctors? we really just want you to get better. I say, all my friends who I know, I have two hands here. Hand number one, we want to keep you out of harm's way. And hand number two, we just want you to feel better. So really the best part of my day is when somebody comes in and says, hey, you know what? I feel great. It really worked. Thank you. And it doesn't matter whether it's a sinus procedure or a neck dissection where I'm peeling out cancer, or as silly as it is sometimes removing cerumen, wax impaction in the ear. It can be very satisfying when they beam up and you see the brightness in their face and they just say thank you.
Yeah, I tell patients I'm a cerumenologist. I'm an expert at removing wax.
It's one of the most satisfying things. My nurse practitioner and PA, who I'm blessed to have working with me in the office, they get such a kick out of that because people are so doggone happy when they say, I can hear again. Thank you.
Yeah, no, it's amazing. It's the simple things that sometimes make a huge difference
Absolutely.
in people's lives. And so, most of us have kind of, a few, if not hopefully more, great patient stories. Like, that time where something happened great. You think, this is why I do this. This really makes me jazzed. Tell us one of those great stories.
Well, again, I don't want to sound like a mitigator where I love it all, but I mean, ENT, I chose ENT, first of all, for a great reason, as many of us did. Otolaryngology, you deal with men and women. You deal with the elderly, children, adults. You deal with some life-threatening conditions, and you deal with some small lifestyle conditions. You can deal with cosmetic changes, skin cancer. I mean, the breadth is staggering in otolaryngology. So for somebody who does not want to be bored, otolaryngology was a great field to go into because of the breadth. That said, I can think of very specifically one right off the top, a gentleman who had a sore throat, and I think you know where this is going. Had maybe a couple antibiotics, and I take a look. We use the flexible scope to look in the throat, and I don't see anything. And I say, well, I don't see anything, but I'm a little cautious. Let's check you out. Let's check in a couple weeks. And after a couple times, just a hint of something. And these are the things that really make you happy. When you catch something that's early, and this is a very particular gentleman who just had a beaming smile and was very thankful and almost adopted me as one of his kids, where I ended up doing an endoscopic invasive tongue excision and a neck dissection to peel out the cancer. And the wonderful gentleman maintained cancer-free for the remaining 15 years of his life, and unfortunately passed away about 2 years ago. But I was close to him personally and professionally during that entire time. And that's just one of
really
many
great, right?
examples.
You looked, you found something, you took it out, and his life is saved. Obviously we all pass away, so
Yeah.
you're not going to stop that unless you've got some secret I don't know about.
Yeah, I told Fountain of Youth. He did it at a ripe old age, and he was happy and satisfied as a human being, and that just made my day.
Oh, that's great. That's great. And so, tell me about some of your mentors. Like, when you think about, somebody who made a big impact in your training or something, tell me about.
Yeah. Well, I had a unique experience when it comes to otolaryngology, maybe a bit different than some people, because my internship started in general surgery at the Naval Hospital, San Diego. So I was there, and I had a friend of mine who I went out when I was a medical student, did my rotation. He said, you got to go to do your first rotation as ENT. It's a great specialty. I had not rotated as a medical student until I talked to him. And I rotated and I said, wow, this is a great specialty. A guy named Mike Johnson, who's an otolaryngologist now, he's the one who sparked my interest. So I ended up, after my general medical officer tour, getting accepted for a post-grad 2 position in Buffalo, New York. I went to Buffalo for a couple of years before I went to Penn. Great guy. As serendipity would have it, his name was Mark Wax. And he's a head and neck surgeon at University of Oregon now, but he was one of my mentors in Buffalo. Just a super great guy, motivated, complimentary, a great mentor, got me really interested in being able to have a good relationship and interaction. I ended up not going into head and neck specifically as a fellowship, but a super great guy. And then segued over to University of Pennsylvania, where I could have thrown a dart, and they were all just wonderful, real hard-charging people. Working under Dr. Kennedy there really helped me with my interest, one of my major interests, which is sinus surgery. That's been a lot of my interest as a private practitioner. But I like to call myself a Renaissance otolaryngologist because I tend to still do everything I can, except, let's face it, hard ear surgery, which I send to Dr. Sims. Thank you. And I tend to still be a Renaissance otolaryngologist. So,
I've always chuckled what's the name of your practice?
Arizona Coast Ear, Nose, and Throat,
Right,
because we're on the coast of Arizona to California.
Okay, all right, that was the origin of that, right?
Yeah, exactly.
Do most of your patients get that?
Not all of them. I've actually had people say, "What are you talking about? The coast is California." I said, "Well, yeah, it's kind of a play on words because we're on the Colorado River. Lake Havasu is actually a dilation of the Colorado River. It's not a lake proper because it's just the Colorado River. So we get to see the beautiful sunsets over California on the West Coast, but we're on the coast of Arizona."
But you grew up on the West Coast, is that right?
I grew up in Santa Barbara. Yeah, surfing. Maybe not great, but surfing and scuba diving on the coast of California.
Is that one of the reasons you chose to settle in a water-based? I mean, frankly, there aren't a lot.
Yeah, great question, Mark. We, as most of us do, I tell patients the same thing. We residents, we doctors kind of move around like professional sports players. You may end up in this city, and then the next time you're on the opposite end of the coast. So my venture took me from Santa Barbara to Milwaukee to San Diego to Buffalo to Philadelphia to Lake Havasu. And when I was looking, it was more regional. I was looking for practice opportunities where I could be a private practitioner. And then I was also looking geographically. And the Southwest more fit, my mantra. I was close to the coast, close to Mexico, close to skiing.
Oh, that's great.
I like the outdoors.
Yeah. What's your favorite sport out of all those?
Well, the funny thing is my favorite sport is an indoor sport right now. It's racquetball. I play twice a week. But I do enjoy snow skiing. We went to Utah just recently to snow ski.
Oh, okay. Well, that's great. So. And so, in terms of, where you see ENT now and where you see it going, what's your insight or your feelings about that?
Still the best specialty. A lot of people would ask, well, if you had to do it all over again, we've all heard that, if you had to do it all over again statement. Well, if I had to do it all over again, I'd be an otolaryngologist. I mean, there's no ifs, ands, or buts. I mean, as far as medical specialties go, I hit the one that fits me personally, and most otolaryngologists I know feel very similarly about that. So,
well, before you go on, I mean, what I would say is most of our peers in ENT are very happy. And so, they're happy for a reason, right? Because they like what they do all day. So it's a great specialty to that. That's one of the reasons I was attracted to it is the ENTs I knew enjoyed their work every day. And there's some other surgical specialties where people aren't happy.
Yeah.
From my perspective, I hope they are happy, but
I do too. But I agree. Again, I don't mean to disparage any other. They're all great, very important specialties, but otolaryngology seemed happy, as you say, and very satisfying.
So where do you see it going in terms of the future?
So, yeah, great question. I think technological advances have really revolutionized our field. It continues to be more and more. And it has been pulled to some degree from the hospital to the surgery center and subsequently from the surgery center to the office. So many of the things we used to do standardly in the hospital have gone to the surgery center, and many standard things from the surgery center we're doing in the office. For example, sinus surgery, for one, being trained at a big sinus surgery institute, that was one of the mainstays we did. And now we're kind of doing a lot of minimally invasive type procedures right in the office and getting very good outcomes doing that with less money and less cost to the patient. So it's been very helpful.
That's great. So a patient can come to your office and get sinus if obviously they need it, it's appropriate.
Absolutely.
They can come in, go into your office, get it done, and go out and have their sinus disease resolved.
Absolutely. Absolutely. I like to use, again, we all doctors have all our standard statements to patients. One of my standard statements to all people is really what it boils down to. I stand on the shoulder of giants. We all do, of the scientists, the clinicians, the people who did the original surgeries, and they are amazing me. For instance, the wonderful man Howard House and Bill House, all those folks that did a great job. We stand on the shoulders, but pragmatically, when it comes down to it in my office, I tell them, what can we do to try to help the problem?
Right.
And that involves four things: nothing, medicines, therapy, and procedures. And I kind of try to go in that order. So, if medicines, including prescription or natural or over the counter or what can help it, that's fine. Therapy, of course, could include immunotherapy for allergies, and then surgery or procedures. And if it's correct and if it's the right thing, it's certainly some of those surgeries have been pulled into the sphere of the office with really good outcomes. So I've been very pleased.
So you're doing, I assume, sinus balloon surgery and nasal surgery predominantly in the
Yeah,
office?
absolutely. Those are I'm some of the two big areas that I would do in the office are sinus. There's balloon sinuplasty where I always say we make small holes into big holes. That's all we're doing. Opening little ostium to allow air to flow in and mucus to flow out, decrease pressure and plugging and pain. And then there's a newer procedure that I'm doing called Vivair, which is to help nasal congestion and obstruction when people have difficulty breathing. It's particularly applicable for people who are on CPAP too, who have difficulty utilizing their masks due to nasal obstruction. This can be a big help for them.
So patients with sleep apnea use the positive pressure mask.
Yes, when they're trying to get the pressure in and they have obstruction, this helps open them up. There's the other group of people who have the chronic runny nose. They may not be allergic, but they've got their hanky out when they're out to dinner and they're kind of embarrassed because they're rubbing their nose because their nose is running. The Ryanair is a procedure where we cauterize back near what's called the sphenopalatine foramen and kind of turn off some of those nerves that cause the runny nose. So
that's great stuff. So it's awesome for me because, as I said, I'm the EVNT, so learning about the other stuff is...
Yeah, it's really pretty cool, minimally invasive things. I tell everybody, you get to see what's really interesting in medicine and with the device people is you'll see the video and you see the person getting ready for their procedure and then they're getting their procedure and then after the procedure, and I tell them, well, maybe that's a little dramatic. There's going to be some crusting and swelling.
Yeah, there might be a little grimacing in the middle. But,
a little grimacing. But at the end of the day, it does make a big difference. So,
well, this is great, Devin. I really appreciate your time. One of the questions I always like to ask people at the end is like, so say this is, we have an award or show, or you're getting a Lifetime Achievement Award, and it's your time to thank the people who made the biggest difference. Who do you thank? Who are the people that you get to give a shout out?
Oh gosh, I'd probably have to get that hook from the stage where I'd be thanking too many people. But I thank my parents. I thank my parents first and foremost for teaching me the value of education and honor and hard work. I certainly thank all my mentors who've allowed me to learn under them. And I will give a huge shout out to my wife, who's been my support system, my children, and then my staff, who have been wonderful over the years. I've really worked with great people who've supported me. And last and certainly not least, my wonderful patients. I've got great people. I feel very blessed to work with the people I work with. I enjoy the interaction. I enjoy the didactic. I enjoy talking around my town. In my little town of Havasu, I've probably done 40 talks over the 20 years. And I do an annual lecture to the scrub tech at the community college. And I do a talk every year. So it's been a great place. It's been a great give and take over the years in my small community. So I've been very blessed. That's
great. Well, we have Devin Cunning from Lake Havasu City. He's at Arizona Coast ENT. This has been a great time to visit with you. Devin, how can people get a hold of you if they want to contact you?
Well, thank you. Arizona Coast ENT.com. And our phone number.
All one big Arizona Coast ENT.
Arizona Coast. Actually, it's azcoastent.com.
Okay.
And then our number is 928-854-5368. Yeah. And Google me. We've got we've got presence on Facebook and Instagram, both on Arizona Coast ENT on Facebook and Instagram as well.
Great. This has been great, Devin. I appreciate your time. Thanks for visiting with us. It's always a pleasure to connect with you.
Thank you so much, sir. Really appreciate it. Appreciate all you do out there too, with all of us who need to send you these complicated patients.
Oh, my pleasure. It's a privilege to take care of these people. Really, I really feel blessed, and I love what I do. So we're both well off.
It shows.
Thanks, Devin.
Thanks, Mark.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.